getting ready for summer right now. We're in that final rush for people who want to make their summer bodies. Now is the time. We have to start early, get that done now so you're ready for bikini season. So whenever we talk about body contouring, some of the most common procedures that we do is liposuction, and often combined with fat transfer for BBLs or fat transfer to the hips, even fat transfers to the breast. But one of the things we always want to think about when we're doing liposuction is skin quality and the possibility for loose skin after that procedure. So it's one of those things that's actually hard for plastic surgeons to predict who's going to be the perfect candidate for liposuction. But some things that are in your favor if you're looking to get a liposuction procedure is being young, especially anyone less than 30 years old, having limited amount of stretch marks as it is right now. That's usually a good sign that your skin has good quality. And 3 is depending on if you've had massive weight loss or not. Most massive weight loss patients are definitely going to have some loose skin with some of the liposuction procedures, specifically in certain areas. So we always want to think about liposuction in terms of areas. Our back tends to respond really well to liposuction and contract, and it doesn't have many contour irregularities. Doesn't necessarily mean that it's going to get rid of rolls on your back if you have rolls on your back, but it tends to smooth out very nice. Some areas where we want to always think about adding some additional tools to traditional liposuction to help get the best results are places like the arms, the abdomen, the thighs. And we have a few tools in our toolbox. Also submental liposuction for people that want a more chiseled face and chin. We have submental liposuction. And so what we're talking about with traditional liposuction is literally injecting tumescent fluid, which is fluid that has hemostatic properties to it, has epinephrine in it to stop bleeding, and it helps break up the fat. And then we just do traditional liposuction with a cannula that sucks out the fat directly. But we have some adjuncts to that. Specifically, Vaser is an ultrasound energy that's applied to the areas that we're going to be liposuctioning. This is called Vaser, and again, using ultrasound technology. What does this do for us? It does a few things. It helps break up those fat cells from the connective tissue. Certain people have more fibrous compositions, and it's harder to get that fat out. And Vaser is really helpful with those patients. Any patient that's had a previous round of liposuction, Vaser is also extremely helpful with getting that fat out of the scarred-in areas, breaking down fibrosis, and leaving a more smooth contour. It's also heating up the surrounding connective tissue, so this is causing some degree of skin tightening or tissue retraction, which really helps with the final result and get a really nice result. It's also decreasing blood loss, so that heat also heats up the very small blood vessels and helps it become a more hemostatic procedure. It's really a pretty significant difference when we're doing liposuction. It's always typical to get some blood mixed in with the fat that we're removing. When we treat the areas with Vaser first, that fat comes out super clean, and it's just this pure liquid gold that we can then use to inject for BBL. So that's one of our adjuncts that we have to traditional liposuction. The other one is BodyTite and FaceTite. Now this is a great technology that uses radio frequency. Again, the main thing that this technology is looking to do is skin tightening. So it also helps break up fat a little bit, but it's more used for skin tightening. I love this for the arms, the thighs, and then again for that submental area for the chin with FaceTite. So this radio frequency, the nice thing about BodyTite is there's a few technologies that use radio frequency. Another one is something called Renuvion. But the nice part about, and that uses a radio frequency plasma, but it's not really monitored as closely as the BodyTite. The BodyTite has a temperature probe right on top of the areas that we're treating, so we can see when those areas get to the treatment temperature. We know we're not over treating, which can lead to issues like burns and that kind of stuff, but we know we're treating with the right amount of energy to really get the maximal effect with skin tightening for the arms and thighs. Again, this always is not a trade-off for different procedures. If you really need a brachioplasty, if you've got a lot of loose skin on your arms or something, you probably need a brachioplasty. But if you have a moderate amount of loose skin, a little bit of adiposity or fat in the area, the combination of BodyTite with liposuction can get you a great result with just very teeny tiny scars, not the big scar that's required for a brachioplasty. So we've kind of covered a few things related to liposuction and the other adjuncts that we use to help maximize our results. Do we have any questions from the audience in regards to those things?
Yes, Doug. Just 1 second here. Okay. This one, they can be combined. I guess BodyTite and Vaser.
Yeah, they actually all can be combined. We could do all of them. You do want to start thinking about over-treating areas. So like I said, I really like Vaser for people that have had previous rounds of liposuction. That's my main go-to for those patients, or patients with just a mild amount of skin laxity, or patients that really want the high definition results. I really recommend Vaser for that. We can also use BodyTite in the abdomen. We just have to be very careful about then over-treating the areas, because when we combine too many of these things, the risk for certain things like burns, lipoburns, can go up a little bit from over-treating the areas. But yes, they can all be combined.
I'm thinking on having surgery. Do you have any experience with banding arms?
Banding arms?
Banding arms?
I assume she's talking about brachioplasty or liposuction to the arms, and yes, we have a lot of experience with both of those procedures.
Okay. The same question again. Arm banding. Another person asked what she's asking for. Yeah. Okay. This question for you, she asked if we have payment plans on Pure.
Yes, we do. We use something called Care Credit. I believe we have a few other things depending on what your credit situation is. And so if you talk to our coordinators at pureplasticsurgery.com, they can give you all the options for financing your surgery, but that's a very common thing for people to do.
And at our website, you can find
Pure.
Cherry, Alphayon, Care Credit, and Patient Time.
There you go. Willie, he knows all the options.
Okay. She said, perfect. You're welcome, Nani. Another question, Doug, it's about implants. Saline, they are safer than silicone implants?
No, not in my opinion. So what's the difference between silicone and saline implants? It's all based off of what they are filled with. So this is a silicone implant, but a saline implant is basically the same thing on the outside. They both have a silicone shell, so what's touching your body is still silicone. The difference is what they are filled with. So this is filled with a highly cohesive silicone gel, whereas saline implants are just filled with salt water. One of the advantages of saline is you know very quickly if you had a rupture because you get a flat tire. With silicone implants, it requires some monitoring with imaging to keep an eye out for any sign of rupture, and that can be either an MRI or a high-resolution ultrasound. But 99% of what I place in patients in 2025 is silicone implants.
Doug, what's your opinion on BBL with dermal fillers on TikTok?
So it can be, so there's a few different fillers that we're using for BBLs. Historically, Sculptra was one of the more common ones. Very cost prohibitive for certain patients depending on how much volume you need. The newest thing we have, which I think is the best alternative, is something called Aliquay. Also on the expensive side, but we're getting decent volumes, and it's using actually cadaveric fat that's been treated and gotten rid of all of the cellular material in it, and it's something that acts as a scaffold for your own body to fill up. And it has a very high survival. It's not going in alive, but it has a very high retention rate. Whereas when we graft fat, it's usually about 65% for the butt, a little bit less for the breast. Aliquay has a much higher retention rate long term, and so it's a great option for someone that has very little fat.
Okay, Doug, we have two different questions, but the same question at the end,
Okay.
so I'm gonna read both, okay?
Sounds good.
One on Instagram said, should breast implants be replaced or not? And here on TikTok, how often should you get your implants replaced, or is it okay to keep them
So this is a great question, and again, it goes back to what implants you have. If you're really stubborn about not wanting to do it and you're not having any issues and you have saline implants, you'll find out at some point, they say after 10 years, the risk of implant goes up a few percent per year. And so you'll get a flat tire with the saline implant. And saline implants were very popular 15, 20 years ago. And so there's still people out there with it. Silicone implants, they all do need to be replaced. So it's something you need to keep in mind when you are signing up for a breast augmentation and you're a young person. You're gonna need to do this a few times throughout your life. The question comes, how often do we have to do that? And that's really kind of subjective. If you're not having any issues, even though the manufacturers only guarantee them for 10 years, depending on which manufacturer you're talking about, doesn't mean you need to just arbitrarily replace implants at that point. I always tell patients, you need to be doing the imaging though, either an ultrasound or an MRI, starting at 5 years after placement, every 2 to 3 years after that, to keep an eye on the implant to see if there's any sign of rupture. If there's a sign of rupture, they should be replaced then. But even just prophylactically thinking about it, at the 15, 20-year mark, if you have not had them replaced it, you should start considering it, especially if you're going to be undergoing anesthesia for some other plastic surgery procedure. It's oftentimes a good idea to just combine the two and replace them at that time so you don't have to do a separate procedure to do that.
I have saline implants and have them since 2004. I also breastfeed 2 babies with them.
So, and that's great. One of the things about saline implants though, and even though you notice right away that they've ruptured, then you're walking around with a ruptured implant and a normal one for however much time it takes you to get scheduled with a surgeon. That's another reason to potentially plan for it beforehand, because you don't want to be walking around with 2 different sized breasts. The other thing I tell patients that are in that position is, when I replace your implants, there's always going to be the one that ruptured. If it's been a few months, it's going to be higher and tighter because your tissues have naturally contracted. Typically with time it relaxes and they even out and they become very even, but there's a period of time where if we're waiting a few months before we get a chance to replace a saline implant that's ruptured, things are going to look a little different until your body gets a chance to relax again.
Thanks. I know it's time. I want to finish having baby first and then get a lift with the new babies.
Perfect. Let's do it. All right, everybody. Thank you so much for tuning in. Have a great weekend. Have a blessed weekend. I will see you next week for Thursday Thoughts.
Thank you.